Hi, I'm Meg. Welcome to plantfitmeg. Welcome back to my channel. Today I want to talk about endometriosis, also known in the community as endo. I think this is a really important topic to discuss because endometriosis often goes underreported and undiagnosed for a prolonged period of time. So if I can do my part to raise some awareness and discuss symptoms and diagnosis and possible management or treatment options, then if I can at least help one person, it will have been worthwhile to create this video and be a little bit vulnerable and share a little bit about my own experience with endometriosis. I'm not a doctor, I'm not a healthcare provider, but I'm someone who has dealt with endometriosis and done quite a bit of research about it over the years. So I want to share what I know and share what has helped me along the way. This video is for anyone who thinks that they might be dealing with endometriosis, or if you know anyone who you think might be dealing with it as well. So what is endometriosis? Let's define it before we get into this. Endometriosis occurs when tissue similar to the endometrium grows abnormally elsewhere in the body. Most commonly, this tissue grows within the pelvis. Endometriosis affects at least 1 in 10 of us, and it really affects people very differently, with symptoms ranging from mild to moderate to completely debilitating. Although everyone's experience with endometriosis is different, there are several common symptoms, and I'm going to share them with you now. One extremely common symptom is pelvic pain, and this pelvic pain can occur during menstruation, it can happen during ovulation, it can also be a daily occurrence and chronic pain as well. Know that extremely painful periods are not normal. If your pain is not being managed by over-the-counter medication like ibuprofen, acetaminophen, and the pain is interfering with your life, that is not normal and it should be addressed. Other common symptoms include bowel symptoms, including constipation, diarrhea, painful bowel movements, abdominal bloating, nausea, and vomiting. Bladder symptoms can also occur, including bladder pain, pain with urination, urgent need to urinate, and frequent urination. Fatigue is another extremely common symptom that people with endometriosis experience. Up to 94% of people with endometriosis experience fatigue. This is one of the symptoms that can often be sort of minimized or ignored, but it shouldn't be, and it can have a massive impact on someone's life. People with endo can also experience pain with sexual activity either during or afterwards. And in about 1 in 3 people with endometriosis will have fertility issues and will have problems getting pregnant. Diagnosis can be extremely challenging. It can take upwards of 5+ years to receive a diagnosis from the time you first see a healthcare provider and discuss your symptoms to finally receiving a diagnosis. Unfortunately, symptoms can often be minimized or dismissed or can be related to other conditions because these symptoms obviously are not just endometriosis specific. They can occur in other diseases, other syndromes, other situations. Sometimes healthcare providers won't take you seriously, and you have to be incredibly persistent and really advocate for yourself in order to be heard and in order to be referred to appropriate specialists, referred for testing, and for the appropriate exams to be conducted to help in trying to get a diagnosis and get your symptoms managed in the meantime. Typically, the first step is to see your healthcare provider, see your doctor, or see your OBGYN and discuss your medical history, discuss all of your symptoms. I highly recommend taking notes and keeping track of what's going on with your symptoms, particularly if things change. For a very long time with my endometriosis, I had it well managed. I knew that I had a couple of endometriomas, which are cysts that grow on your ovaries. And so I knew that I had those and that they existed and that I had endometriosis and sometimes would have flare-ups during my period. Unfortunately, over time, those endometriomas grew and my endometriosis worsened over time, which can happen. And unfortunately, my symptoms worsened dramatically, and I needed to take steps to manage those symptoms and then also find the right specialists, see the right people, and take time to figure out a treatment plan with my healthcare provider. They will often, in your first meeting, do a pelvic exam, so they will see what is going on there, if they can see anything or detect anything. If endometriosis is suspected, often you'll be sent for some kind of imaging. That can include ultrasounds, which can be transabdominal ultrasounds, which are kind of the typical, what you would think of as like if a pregnant woman went to get an ultrasound on, you just have the wand on your belly. But there can also be transvaginal ultrasounds where they use a transducer and place it into your vagina to see what's going on in there. If they see something on the ultrasound and they suspect that there's something going on, whether it's endometriosis or something else, you may also be sent for an MRI, magnetic resonance imaging, so that they can get a clearer picture of what is going on in your pelvic area. An important thing to note here is that sometimes, even if your ultrasounds are clear and your MRI is clear, you could potentially still have endometriosis. And this is part of why it is difficult to detect and difficult for providers to diagnose. Because I had endometriomas, which are cysts that grow on your ovary, that was visible on ultrasound and in MRI imaging. So they could basically say, okay, this is what we suspect, that it is endometriomas and that you have endometriosis. But for a lot of people, that is not the case. And if there aren't any cysts there or anything visible on imaging, you might not get a diagnosis, but still be dealing with endo. Endometriosis can also be diagnosed through surgery. They would do a laparoscopic procedure, which is less invasive than your typical laparotomy. They can do an exploratory surgery just to look for endometriosis and see if it is present, but best practices dictate that if they're going in to explore, they should also remove any endometriosis that they see at that time so that you don't have to have a second procedure. The only way to definitively 100% diagnose endo is to examine the tissue post-surgery. So they can be fairly confident of the diagnosis depending on your symptoms, depending on what they see on imaging and in different circumstances. But until they test that tissue, they don't 100% know whether it's endometriosis or not. So there's no cure for endometriosis, but there are things that you can do to manage the symptoms and manage your endometriosis and have a treatment plan for it. Pain medications can be used to help with painful periods, or if you're having daily pain. That was the situation I ended up in where I needed to take pain medications every day to manage my pain symptoms because they were so extreme. You may also be prescribed medications that impact your hormones. That could be a combined contraceptive pill like the birth control pill, or it could be another type of hormonal pill. I won't get too much into this because obviously this is very specific and you would need to speak with your healthcare provider about it directly. Pelvic physio can help with symptoms, and I went to pelvic physio before I had my surgery done, and I did find that it was extremely helpful. I had symptoms in terms of like frequent urination and feeling the need to pee all the time, and it was really frustrating and really stressful. And she was able to help me sort of manage that and improve it slightly. So that was really helpful. I do strongly encourage, if you do have endometriosis or even suspect that you do, try pelvic physio just to see if there's any kind of relief, any kind of improvement. I also found having someone in your corner who understands the disease and understands the condition and who can help provide guidance and be an encouragement and, encourage you to take other healthy lifestyle choices as well, in terms of like getting moving a little bit and things like that, was also really helpful and really empowering for me. Mental health support can also be incredibly important and incredibly useful for people with endometriosis. Anxiety and depression are common comorbidities with endometriosis, so they can co-occur. So absolutely seek mental health support if you need it. Chronic pain care can also be helpful. There are specialized centers and specialists who help with chronic pain advice and chronic pain care, so that can be an avenue to go down as well. There are also complementary and alternative medical approaches that can be used and might be helpful, including acupuncture, cannabis, diet and nutrition, exercise, heat, meditation, breathing, relaxation practices, and yoga. I found heat to be incredibly helpful. I always had heating pads and a magic bag and these kinds of things on my pelvic area because I was in pain daily for quite a while there. In terms of surgery, typically a laparoscopic procedure is preferred over a laparotomy, and that is because it is less invasive, less painful, and is a faster recovery time. Typically, excision surgery is the gold standard for endometriosis care. Excision surgery involves the removal, the cutting away of the endometriosis tissue and endometriosis growths, whereas an ablation surgery would be a burning away of that tissue, and it has been shown that excision is typically, most of the time, preferred. Research shows that excision surgery is more effective. So for me, I also had a condition called adenomyosis, which occurs when endometrial tissue grows into the muscular wall of the uterus. And the only way to fully get rid of adenomyosis is a hysterectomy, so a removal of your uterus. So what happened with my surgery and my treatment plan was I had an endometriosis excision surgery with the removal of the, I think, 3 endometriomas that were growing on my one poor little ovary. I only have one ovary because I am an ovarian cancer survivor. I'll leave that video linked up here about my cancer experience if you want to check that out. It's pretty heavy though, so perhaps not, but I'll leave it there in case you're curious or interested. And then I had a hysterectomy, my removal of my uterus to deal with the adenomyosis. And so I still have one ovary remaining. She's still kicking. She's still there. She's still cycling, but I don't have a period anymore because no uterus, no lining of the uterus shedding monthly. So no more period. So that's cool. So I hope this video is helpful in raising awareness about endometriosis. I will leave a bunch of links below for support groups, for information, books, things that I found helpful in my journey. Let me know if you have any questions and I will do my best to answer them. Obviously, check in with your healthcare provider if you are experiencing any symptoms, if you're experiencing multiple symptoms and you don't know what's going on and you're not feeling well and you know that something's not right. Be persistent. Take notes, be very clear with your healthcare providers about what is happening, when it is happening, and how it is happening, what changes you've noticed. If maybe you were okay for a while, like for me, my pain was limited to my menstrual cycle, and then it turned into pain all the time. Massive change, massive difference. Let your healthcare providers know. Insist on being referred to specialists and seeing the right people. Not all gynecologists are equipped to deal with endometriosis, which might be surprising, but there is such thing as endometriosis specialists and endo surgeons, so that's important to know. Again, I will link a bunch of resources below. If you have any questions, I'll be happy to answer them, and I'm wishing you all the best. If you or someone you know is experiencing endometriosis-like symptoms, I hope that you are able to find the care that you need, that you're able to find an answer, find a diagnosis and management and treatment, and whether it turns out to be endo or it turns out to be something else, I'm wishing you all the best on your health journey and finding answers and feeling your best, feeling healthy and feeling well. I know this was a little bit of a different video than my typical content of plant-based recipes and healthy lifestyle tips and fitness advice. So feel free to peruse my channel, check out some other videos if you're interested. I'll leave a couple here that you can check out. I hope you're having a good day, and I'll see you in the next video. Bye.